you?
I'm good. How are you doing?
I'm doing good. I'm doing good. I'm excited to chat tonight.
Me too. I see people are joining us. We can wait a
They
few
are.
minutes because we are early tonight.
I love it.
How was your day?
It was good. Saw a lot of patients, had some good pregnancy news, so that always makes the day really nice. What about
I
yours?
I agree. Today we were able to help some people make some embryo matches, um, our little side project, as well as giving our very first grant for IVF in Cincinnati.
Oh, that's so exciting. I'm so excited about the Cincinnati program and how it's growing.
Me too. Me too. I still see people joining us. Thank you. We're going to get started in just a sec.
I think before we know it, we'll look back on it in a couple of years and we'll see JFF all over. And we'll be amazed that it started in Atlanta and then we were just in two cities.
I hope so. I mean, a girl can dream, right? But the goal for real is 15 cities in 5 years, right? You know that.
hmm And
Okay, yeah,
I think we can do it.
let's do it.
And we're seeing lots even more join, so this is great.
Yeah, and this will be recorded as well so that we are able to post it other places.
Perfect. Sounds good.
All right, shall we get started?
Yeah, let's do it.
Awesome. All right. Welcome, everyone. My name is Ilana Frank. I'm the CEO and founder of Jewish Fertility Foundation. And we are so excited that you're going to be joining us tonight. We're going to be learning and chatting with and talking to Dr. Jessie Rubin from Reproductive Biology Associates in Atlanta. And before we get started with the evening's conversation, I'll share a little bit about my background and how I came into this space and how we met, even though we previously met many, many years ago. So basically, like many of us who are working in the space of infertility, it is personal. I struggled a lot for many, many years to be able to have my three children. They are born through fertility treatments. The first two I was lucky enough to have in Israel. And thanks to socialized medicine, the cost to have them was inexpensive. It was actually free. And it didn't come without the hardship that is infertility and the struggle of infertility. It was really, really hard on my marriage. It was hard thinking I was the only one in the world going through this. I literally thought I was the only one in the world only 11 years ago. Social media wasn't what it is today. I did not share it with my family. You know, my mom, you know, my family, they did not know what was going on in the beginning. And today, now, I don't stop talking about it, but they were really helpful once I started sharing my journey, and especially kind of the second half of my journey when I moved back to America with two small little children was when I started really talking about what I had gone through and how they came to be. And to have my third child, we struggled even more. We tried to go through adoption. We were back at RBA trying everything we could with doctors there. It wasn't working. And then it led us to embryo donation, which is a whole nother story of how I had my third child. And throughout that process, during that time, we decided, a few of us, that we were going to start an organization so that people didn't have to worry about the financial aspect of what it meant to go through fertility treatments. I felt really lucky when I was going through it. Again, my first two children did not cost me anything. The third one cost me a little bit more, but it's not fair that people have to pay, you know, so much money to be able to go through this journey. And that's kind of why we're here. But we also understand that it's important to offer financial assistance just as much as it's important to offer financial, emotional support. So today, Jewish Fertility Foundation does three main things. We offer financial assistance through grants, and we also offer it for not only, and we'll get into some of the details a little bit more later, but IUI as well as IVF. So right now we're offering in Atlanta, in partnership with RBA, $1,000 IUI grants and up to 15 $1,000 in IVF grants. Plus, if you're a grant recipient from Jewish Fertility Foundation, RBA will offer a discount of $4,500. Plus, you can even apply to our partner, the Jewish Interest Free Loan Association, to request a $7,500 worth of interest-free loans. So you can honestly leave our offices in partnership with RBA with a significant amount of funds. While money is important, emotional support, honestly, is just as important. And when you're going through the ups and downs of infertility, Jewish Fertility Foundation is here to offer you free emotional support. And everything we do is community-based. So if you're living in Alpharetta, then we are going to come to you in Alpharetta. If you're living in Sandy Springs, we're coming to you in Sandy Springs. Of course, now everything is virtual, but again, our services are open to anybody, regardless of religious background. You can be a single parent by choice. We are here to help. Again, financial support, emotional support is important, but we're also offering educational training. So tonight we might consider this some educational training, but we also offer our community panel conversations around how to love somebody with infertility, or how to become a parent through pathways to parenthood. And then we also go into the fertility clinics like yours and work with the doctors, the nurses, the admin team, and talk about special needs of some of our Jewish clients. So in summary, we are here to help. We do have funds to offer your patients. And honestly, we want to just get in touch with our clients in Atlanta and figure out how to help them. So enough about me and my story. We are here to talk to you. So Jessie, I know we're acting a little informal. It's true. We do know each other from growing up in Atlanta. And you know, what's really interesting is to see where you've come and how you've grown as a really impressive doctor. And I think our listeners really want to get to know you and why you chose to do this. So tell us a little bit, where did you go to school, and where did you do your medical training?
So as you mentioned, we've actually known each other for many, many years, probably at the point where I did play dates as a kid in your house. And I'm a native of Atlanta. I love Atlanta. A lot of my family is in Atlanta, and I always knew it was somewhere where I would end up and where I would stay. When I was younger, I went to Hebrew Academy for school, then I went to Woodward for high school. When it came time for college, I really just wanted something different. So I moved all the way to New York, probably as far as I thought I could realistically go while letting Jewish parents still let me leave the house. And I went to Vassar up in New York, absolutely loved it. And it was at that point where I really thought I wanted to go into medicine. A lot of people in my family are physicians. My father was a physician. I have aunts that are physicians. My grandfather was a physician. So it was a lifestyle that I really saw quite a bit, but it wasn't until college where I really kind of made that connection that I, nerdy enough, loved the sciences and thought it was actually a really good fit for me. I got a little bit of cold weather, moved back down to the South for medical school. I realized New York was not for me in the winters. I went to MCG, and then I did my residency in OBGYN at Emory. And then finally my fellowship in Houston at Baylor College of Medicine. So I've kind of lived up north, I lived down south. I finally feel like I'm back at home. And I also feel like I'm really doing what I was meant to do. When I was going through medical school, I fell in love with OBGYN immediately. I love forming close connections with my patients. I really liked having follow-up with patients and not just seeing them once and never seeing them again. And then I also loved having the opportunity to do clinic, but also to do a little bit of surgery. So I was immediately drawn a little bit to OBGYN. And then I think probably on my first day of my fertility rotation, I knew it was for me. There was no question. The idea to be able to help people create and build their families, especially when they've been struggling so much,
right,
so rewarding. And even now, as I was telling you earlier, it makes my day every time somebody gets pregnant. And every time somebody doesn't get pregnant, it's always on my mind thinking, how can we do this differently next time? And how can we help?
That's such, and I'm sure your family is excited that you're back.
They are. They're glad. they knew New York was way too cold. Houston was way too hot. I think they knew I was going to end up in Atlanta, but they're excited to have me back.
So when you were going through your training, did you focus on any specialty in particular?
So when I was going through my training, I did a lot of training with women who had lower egg numbers, or what we call diminished ovarian reserve. Ovarian reserve is just a fancy way to say what is your egg number or what is your egg. I did a lot of training with women who had lower egg numbers. I did a lot of training over at MD Anderson, doing something called oncofertility, or fertility preservation for women with cancer right before cancer treatment, because that can affect. And I also did a lot of training on women with fibroids and same-sex couples. So I feel like I really had a really good diverse training, and I think my practice at the moment currently reflects that as well.
Do you have something favorite that you'd like to share with us about being a reproductive doctor?
I think it's just the feeling of knowing that you helped
Mm-hmm.
is gets me up in the morning, gets me excited to start my day. And when I go to sleep at night, that's what makes me feel so good and rewarded at the end of the day, is knowing that I was able to form those close connections and knowing that I was able to help people fulfill their dreams of having a child. I grew up as the middle kid of three. I grew up in kind of a crazy household. There was always commotion, always noise. And I really understand when people want to have a child, and whether it's their first child or whether it's additional children, how important it is to build the family in the way that you want to.
Thank you. So I'm going to ask you a question, and I know we've spoken a little bit about this.
Okay?
Um, so we like to dive deep here at Jewish Fertility Foundation. Talk to us about egg freezing. What are your thoughts on
Absolutely.
it?
So you and I have talked about this before, and I think it's one of the most incredible things that we can offer women. And it's something that I did when I was in my early 30s. I was actually going through training at the time. I was obsessively checking my egg number. I think I checked it about 2 weeks into training, and then probably every month for like 5 months.
Wow.
And it was one of those things that you see all the time, that people want to build families, but by the time they hear about egg freezing, it's almost a little bit too late. Meaning they're already, in their early 40s, or their egg number is very low. And I thought about it, and for me, I thought, wait a second, what am I doing? I need to freeze my eggs. And so I froze my eggs when I was actually dating my now husband. I liked him a lot, but you never know. It was early on in our relationship. And what was so
Did
interesting
he
was that
know? Did he know about what was going on?
I was actually terrified to tell him. And I
Mm-hmm.
remember I was a little bit nervous to tell my parents, and my parents were very supportive. But you never know, because parents, all they want is grandkids. So it's definitely an intimidating conversation when you bring it up, but they were completely supportive.
Mm-hmm.
And I remember telling my boyfriend, and we had only been dating a couple of months.
Mm-hmm.
And, I sat down, I was like, today's the day, I'm going to do it. There's no question, I'm going to do it. And I remember that feeling of trepidation. And I finally worked up the courage to tell him, and he looked at me, and instead of going, why are you doing that? Or that's so strange, or why are you pushing to have children? We just started dating. He just looked at me and said, wow, I think that makes a lot of sense. That's a really good idea. You should go ahead and do it. But what's
Awesome.
so interesting looking back on it now is my family was so supportive. My husband was very supportive. But I also, like you, didn't really talk about it a lot when I was first going through it. And it was something that I was almost embarrassed by, or ashamed, that I thought I would get married at a very young age and I would have kids by the time I was 30, and I would be just like my parents and just like all my friends who I knew growing up in the South.
Yep.
And then all of a sudden, up, and I was 30, and I wasn't anywhere close to being engaged and not anywhere close to having kids. And so for me, it was such a good option. And now I'm incredibly vocal about it, because I think there's no reason women should be ashamed about freezing their eggs or doing any type of infertility. Infertility affects 1 in 4 women. It's so common. But as women, we don't talk about it. And so we don't realize how our friends are struggling, or how our neighbors or our coworkers are also going through the same thing.
That's an important message, and I agree with it. Thank you for sharing that. So, I think some of our audience would like to learn a little bit more about some of the basics. Can you just explain to us first what's the difference between IUI and IVF? And when would you choose one over the other?
Absolutely. They are so confusing. It doesn't help that they're acronyms. It doesn't help that they're almost the same letters and they're both three letters. So IUI stands for intrauterine insemination. IVF stands for in vitro fertilization. Let's talk about what those words actually mean. So IUI, or intrauterine insemination, is when a procedure is done where sperm is injected inside the uterus. Every time I explain this, this always sounds much more traumatic than it actually is. But normally what happens is a woman takes a fertility tablet like Clomid or Letrozole, trying to grow some extra eggs. Then they come into the office. If they have a partner, they give a sample. If they're using donor sperm, we already have the sample ready. And we do a speculum exam, and then we're able to inject the sperm inside the uterus. It honestly feels like a pap smear. It sounds like torture, but it's very easy. It takes about 2 minutes, and it's just IUI, intrauterine insemination, injecting sperm inside the uterus. IVF, or in vitro fertilization, is a little bit different. That's where somebody takes medication for about 2 weeks, but instead of doing oral medicine, it's typically injections in your belly with super tiny needles, but daily injections. And then it's a surgery where you're put to sleep under anesthesia with a vaginal ultrasound that will take the eggs out of the body. The goal with IVF is that you take eggs out of the body, you fertilize them in the lab, and you grow them in the lab. So it gives you the option, if you need to do genetic testing for any reason, you can do that before you get pregnant with IVF or in vitro fertilization. Or if there's any type of problem with the sperm and there's not enough or they're not moving well, it gets around a lot of male factor infertility. And lastly, if women have tubes that are blocked and the tubes aren't working, then IVF is a great way to get pregnant. Oftentimes we start with insemination if we can, but sometimes there's reasons where we need to go to IVF, and it's pretty easy to figure out after you do one visit with your initial workup. It's pretty easy to figure out which way you want to go and which option makes the most sense.
That's fair. If we did get a question beforehand about weight limit, and first of all, your feelings about it, and then also how that might factor into going to a clinic like RBA.
Absolutely. First of all, let's just address, we all hate talking about weight. It's so uncomfortable. Every time we have to talk about it, it's something that's difficult because we know it's something that most women struggle with. So when I talk about weight, it's not meant to be insensitive whatsoever. We know that a lot of women struggle with their weight, and some you would know, some you wouldn't know. And so it's a very sensitive topic. But the reason why there are some weight restrictions for fertility treatment is really for the health of the mom, but also for the health of the baby. Women who are very overweight are more likely to have high-risk pregnancies, meaning high blood pressure, diabetes, needing a C-section, having an early delivery. And oftentimes those babies don't tend to grow as well and can have other complications. So that's why there are weight restrictions. What the weight restrictions are based off of something called BMI, or body mass index. It's not a perfect measure by any means, but you take the woman's height, you take the woman's weight, you pop it into a calculator, and it tells you what your BMI is. For RBA, our cutoff for IVF is a BMI of 45 at the time of egg retrieval. People gain a couple of pounds in IVF, nothing drastic, just a couple. I never weighed myself, but just a couple. But when you start the IVF, we like the BMI to be 43 so that the day on egg retrieval it's going to be 45. And we use roughly the same cutoffs as well for IUI.
Okay, helpful. So this is a question I get a lot, and especially, yeah, let's talk about the price. How much does it cost? And if you can be specific as you can to RBA.
Yes. It depends on a little bit what treatment you're doing, what medicines you're taking, what dosages of medicine you're taking, and is there insurance coverage or not. Fortunately, there is a business office at RBA that can walk people through it. So I'm doing my best to do it from my perspective, but I promise we have professional people that are better at it as well. If you're thinking about the first option, which is IUI or intrauterine insemination, normally that's done just taking oral pills like Clomid or Letrozole. And if that's the case, assuming there's no insurance coverage, it's around 1,700 to 2,000. So not inexpensive, but it won't be as much as IVF, which we'll talk about in a second. If you're adding in those injectable medicines with insemination, it can get up to about 2,500, give or take. If you're doing an IVF cycle, you have the option of if you want to do genetic testing or not. And if you do genetic testing, it's just over 18,000. It's about 18,350. And if you don't do genetic testing, it's 14,750. These numbers can be mind-boggling. They make my heart sink even saying them out loud. But there's lots of different programs and things that can help with the cost. And you talked about a lot of the JFF support earlier. And then we also have a shared risks model called the Our Baby Assurance. And what that is that's supposed to help for people who qualify and go through the IVF cycle. If for whatever reason it does not result in a live birth of a healthy baby, we will actually do the second cost of IVF for free, with the exception of meds, up until a total of 7 IVF cycles, which is a lot. You don't have to do 7. But if you went through all of that and you still did not have a baby, we actually give you your money back. Because we know a lot of the stress of fertility is not just the physical part, but what's even harder is the emotional part and actually the financial part as well. So that's what we're trying to help with. If you go with the Our Baby Assurance, which is the up to 7 cycles of IVF, if you qualify, it's actually priced based off of age. So if you're less than 30, it's 19,000. If you're 30 to 34, it's 22,000. If you're 35 to 36, it's 25,000. And if you're 37 to 38, it's 29,500. And we have all of this information too available for you, even if you're not an established patient. I don't expect you to follow all of my numbers, so we can give you all of those criteria as well.
I appreciate it. And it is overwhelming. I mean, it's overwhelming to hear those numbers. It's hard when you're in the loop and when you're in the cycle of going through it, and just to hear those numbers and be so confused. We're here also to support you during the process at Jewish Fertility Foundation. I want to mention again, we do support the 3 areas you spoke about, the IUI grants. We do give a $1,000 IUI grant. We also offer up to $15,000 in IVF fertility grants, and that goes, so if you're doing a regular cycle, I would say, of IVF, RBA will chip in to discount it $4,500 if you qualify for a grant through us. And if you're going to be doing the shared risk model, unfortunately, it's not discounted, but we will, because it's already heavily discounted from what we understand. So we will also financially support that through a grant. And I encourage those of you who are listening today, go to jewishfertilityfoundation.org's website and see if you're eligible for a grant. I will tell you, even if you're not eligible for a grant, our emotional support services are open to anybody. They're free of cost. They're open to anybody, regardless of your religious background. Honestly, I've been there. I've had my children, you know, as somebody who struggles with infertility. It's hard. I thought I was alone. I don't want you to feel alone. Please, we'll do anything we can to help, especially in partnership with amazing, amazing doctors like Jessie, Rubin. And I thank you for your your honesty, your time, and thank you. Is there anything else that you'd like to add?
No, I just want to thank you for being so open about your journey. We both know what it feels like to be on the other side and anxiously awaiting results and anxiously awaiting all of our testing and seeing how the cycle goes. And, you know, it's so important that people don't feel alone. And they need to know that there's financial help out there. And also, really importantly, there's emotional help out there as well. So thank you for raising awareness of it. Thank you for having me. And I'm so glad to be able to help in this small way.
Hebrew Academy forever. Thank you very much. Amazing. Make sure to save it on IPTV. Thank you, Jessie. Have a good night, everyone. Thank you for listening.
Tuning in.